Welcome to today's webinar of the USD Prescribing Research Network. The topic today is Pilot and Grant Planning Awards, Information for Potential Applicants. This webinar is sponsored by the USD Prescribing Research Network, with funding by the National Institute on Aging. My name is Jennifer Chia. I am a geriatric palliative care physician at UMass Medical School and co-lead of the Investigator Development Corps. I will be your host today along with my co-lead, Dr. Kenneth Bookfar from Mount Sinai Health System in New York. Before we get started, I want to cover a few technical details. Due to the number of registrants for today's webinar, we have placed phone lines on mute to reduce audio feedback. So unless you're logged in as a host or panelist, your line is muted. However, we welcome and encourage audience participation using the Q&A feature of the Zoom webinar software. When you would like to interact with the presenter, click the Q&A bubble icon on the bottom toolbar and type your questions in the box. If you would like your questions to be anonymous, you can check the anonymous box before sending. Hosts will acknowledge questions during the final 15 to 20 minutes of the webinar. If you have a technical or logistical question, we ask that you submit those using the chat feature box and select the co-host, Jonathan Norton, to chat privately. Please make sure that you are identified by either your name or participant ID so that our webinar host will be able to help troubleshoot any problems you're having with the audio or any other issues. Finally, we want to extend an enormous, huge thanks to Jonathan Norton at Johns Hopkins, as well as Molina Spar and Anil Rizzo at UCSF, who are doing all the amazing heavy lifting and work behind the scenes to make these webinars possible. And now, without further ado, I'd like to introduce today's speakers, who are joint investigators of the Pilot and Exploratory Studies Corps of the USD Prescribing Research Network. Our first presenter is Dr. Amanda Mixon. Dr. Mixon is Assistant Professor of Medicine at the Section of Hospital Medicine at Vanderbilt University Medical Center and a research physician at the VA Tennessee Valley Healthcare System. She is a co-leader of the USD Prescribing Network's Pilot Corps, and she currently serves as a co-principal investigator along with Dr. Simmons for a randomized controlled trial to determine the impact of deprescribing intervention on medication burden and health outcomes among hospitalized older veterans. Our second presenter is Dr. Sandra Simmons, Professor of Medicine in the Division of Geriatrics at Vanderbilt University Medical Center and Director of the Center for Quality Aging. She's co-leader of the network's Pilot Corps, and she also serves as a co-principal investigator for two randomized controlled trials to determine the impact of deprescribing intervention on medication burden and health outcomes among hospitalized elders. Without further ado, I'm going to hand this over to Dr. Mixon. Thank you for being here.
Thank you very much for that warm introduction, and thanks everybody for joining this webinar. I want to provide my thanks to my co-lead, Dr. Sandra Simmons, and to Joanna Gupta, who is our program support. So we have no relevant disclosures, and we'd also like to thank the National Institute on Aging for supporting this work through funding the USD Prescribing Research Network. So just to review, what is this network all about? Well, formally, it includes the entities you see here on the screen, led by Dr. Cynthia Boyd and Mike Steinman as the co-principal investigators, and the leadership and administrative core leaders. It also includes all of these cores that you see below that initial box, as well as a community out there of you, people who are interested in and working in the area of deprescribing. The red box highlights how our Pilot and Exploratory Studies Corps relates to the other cores in the USD Prescribing Research Network. So as you saw on the last slide and here as well, there are 5 pillars for the USD Prescribing Research Network, or USDeN as we like to call it. Today we'll focus on the funding of pilot studies and grant planning activities. So Dr. Simmons and I co-lead this core, and I'd like to note that all the information that we're presenting today is on the website of the network, which I'll share a little bit later. The purpose of the Pilot and Grant Planning Awards are to support early stage research in deprescribing that will hopefully lead to larger, more robust projects. Also, the funding will primarily but not exclusively be awarded to junior investigators whose studies provide preliminary data, proof of concept, or developmental work that clearly leads to larger full-scale studies. We have two funding mechanisms that are part of our core. The first one is for pilot awards, and the second one is for grant planning awards. The website is listed here for your reference, and I'll discuss each of these award types in turn. Overall, though, the scope of the pilot grants is the next topic. So projects should have a clear and direct relationship to deprescribing. And one definition of deprescribing is on the following slide, but just in general terms, it should apply as a common sense to what is deprescribing and what's clearly related to it. Secondly, it needs to be relevant to older adults. Now, again, there's no fixed definition of what is an older adult, but it should be reasonable and should be relevant to aging. And third, it should demonstrate a clear pathway for how the proposed research will lead to something bigger. For example, a future grant and research opportunities related to deprescribing, the career development that will allow an investigator to embark on a sustained research career with a focus on deprescribing. In particular, we like the definition of deprescribing from the University of South Australia, which says that deprescribing is the process of withdrawal, dose reduction, or substitution of inappropriate, that being high risk, unnecessary, or low benefit medications supervised by healthcare professionals with the goal of managing polypharmacy, but is also relevant to those without polypharmacy with the purpose of improving outcomes. This definition is also on our website listed here. Even though this is the first year of funding for the US Deprescribing Research Network, we do have 3 pilot projects that have been funded. And here you see the respective investigators pictured that are supported through these funds. The projects focus on decisions about anticoagulation in patients with atrial fibrillation and dementia, the attitudes and preferences of older adults for discussions around deprescribing recommendations, and intensification and de-intensification of glucose-lowering medications for patients with diabetes and multimorbidity. So these projects give you an idea of what the scope is for these awards. Next, I'll talk about eligibility criteria for the applicants. First of all, you should hold a doctoral degree, that is an MD, PhD, or equivalent degree. You must be employed as a faculty, research scientist, or equivalent by the start of the award period. You also must be in a setting such as those listed here, like a college, university, training schools, or other fiscally responsible institution that's registered with the System Award Management. And lastly, applicants can submit 1 application. However, 2 or more individuals from the same institution can apply for pilot and grant funding opportunities. A few more details about applicant eligibility are here. First of all, that applicants can be from non-US institutions, but you need to articulate clearly how the proposed research will apply outside of your home country, including the United States. And we encourage applicants from underrepresented groups, disadvantaged backgrounds, and individuals with disabilities. Now I'll give you some details about the available funds. Each award will be up to $60,000 in total costs, which includes both direct and indirect. The indirect costs are charged by the recipient institution's federally negotiated rate, and foreign entities can charge no more than 8% of modified total direct costs. Each award will begin in August or September of this year and in subsequent years, and the funds need to be used within a 1-year period. Each year, we plan to award 3 to 5 pilot studies. So now we'll talk about each of the funding mechanisms individually. First of all, the first funding mechanism is the pilot award. And as I mentioned, the requests for applications are on the USD Prescribing Research Network website. And I just want to be clear that on that website, the RFA is labeled Investigator Initiated Award, but that is equivalent to this pilot award that I'm discussing here. These awards are primarily to fund junior investigators, but not exclusively. Their proposed studies can collect preliminary data, explore proof of concept, or entail developmental work that provides a clear pathway to future larger scale studies. We encourage applicants to use a variety of study designs, such as data for a future clinical trial, observational studies, and/or qualitative evaluations. The second funding mechanism is the Grant Planning Award, and funding will be provided mainly, but not exclusively, to more established investigators. We would like these funds to be used for grant planning activities that lead to submissions of larger research proposals. So now you probably are wondering, what do I need to submit to apply for these grants? So I'll review the materials in detail. First of all, there is a letter of intent, or LOI. These letters are optional, but encouraged, particularly if you are asking for more than the budget cap of $60,000 or for funding greater than 1 year of your work, or if you'd like to get some feedback prior to submitting your full application. The letter should be 1 page in length with 1/2-inch margins and 11-point Arial font. We'd like for the letter to introduce the research team that you're working with, how stakeholder engagement will be included, which I'll speak to a little bit later, as well as some brief specific aims, the approach you plan to take, and/or grant planning activities. And I'd like to emphasize that these letters of intent must be submitted by email to admin@deprescribingresearch.org, and that's also provided in the link that says guidelines on this slide. And they are due on February 10th, which is a Monday, by 11:59 p.m. That's Pacific time. And now a comparison of the requirements for both pilot and grant planning awards. For both of these mechanisms, you will need to submit a maximum of 5 pages that addresses the study aims, significance, innovation, the approach you plan to take, future directions after this grant, and how stakeholders will be engaged in your work. More details about these sections are included in the request for applications on the network website. Also, there's a requirement to include a cover page, which typically has the name and project title and some institutional information. Some other pieces that are required for the Grant Planning Award include the aims and approaches of the larger scale study that will come after your Grant Planning Award, and how this work will lead to grants, publications, and beyond. I'd like to say a bit more about stakeholder engagement. Both the pilot and grant planning awards need to have an element of stakeholder engagement. And what do we consider stakeholders in this setting? Really, it's individuals or groups that would be impacted by your work. So that means for some people, it might be older patients, providers in the healthcare setting, professional societies, policymakers, health plan administrators, public health leaders, and etc. So in this section of your application, we'd like for you to describe the stakeholders you plan to work with, how they'll be engaged, information on how they will inform your work, and a timeline of how they're involved in your study-related activities, as well as the settings and methods of engagement. We don't want to make anybody uneasy or nervous about this requirement, but our network certainly has placed stakeholder engagement as a priority in building the knowledge about deprescribing. Furthermore, as you noted at the beginning, there is a stakeholder engagement core that can help identify how your work can relate to stakeholders and engage them. Some other supplemental materials that are required include a half-page summary description of your work that's in lay terminology that can be shared with the stakeholders that we have involved in the network, an NIH-style biosketch, and for junior investigators, a 1-page mentoring plan and a letter of support from your mentor. And finally, budget forms. And those budget forms include a summary, a justification for people and supplies, the scope of work, and an F&A rate agreement. These budget forms don't count towards the 5-page limit of your science. And just to remind everybody, all these submissions for the full application are due on Monday, March 9th by 11:59 p.m. Pacific time. And when you're ready to submit, please go to our website that's in red, and there you will find the 2 types of submissions, each of that I've discussed previously, with a link to the actual submission site. And at the bottom of that submission site, there's a red submit button where you can upload all of your files and submit them. So now just to review some of the key dates for these awards. First, the optional letter of intent is due Monday, February 10th by 11:59 p.m. Pacific time. The full application is due Monday, March 9th, again at 11:59 p.m. Pacific time. We hope to review all the applications during the months of March and April and May, and then finally have the awards announced by June 1st. The funding will be then distributed by August or September of this year and subsequent years. Once you receive an award from our network, there are some expectations and resources available. All awardees will submit a year-end structured progress report. They will be invited to present their work at our annual meeting of the network, and more on that in a minute. And then we'll also ask you to complete a yearly online survey to track your progress after that initial award period. We have some additional expectations and resources for our junior investigators. Namely, they'll have quarterly calls with Dr. Simmons and myself, which are the pilot core leaders. They'll also have quarterly calls with the stakeholder engagement core to make sure that they are engaging with the stakeholders they said they would. And then there are also optional USDeN webinars and work in progress seminars that are available. This allows our youngest investigators to work with and network with people across the deprescribing community. As I mentioned, there is an annual meeting of our network, and our first meeting is this May, on May 6th, the day before the American Geriatric Society annual meeting in Long Beach, California. The keynote address will be given by Dr. Kara Tannenbaum, who's the co-founder and co-director of our sister network, the Canadian Deprescribing Network. At this one-day meeting, the awardees, as well as network members, will gather to share their research, access resources, engage with stakeholders, network with each other, and find supports, plus a whole lot more. I'd also like to tell you about an upcoming webinar that's being hosted by the Investigator Development Corps, and it is on Tuesday, February 4th at 2 p.m. Eastern. It's featuring my co-investigators, Dr. Sandra Simmons and Dr. Ed Vasilevskis. They'll be talking about SHED-MEDS, which is their NIA-funded hospital-based deprescribing trial for older patients transferred to post-acute care. And there should be links on the network website to sign up for that webinar shortly. I'd also like to tell you about a junior investigator intensive program that's available. This is for people who are junior investigators who would enter the class of 2020 to 2021 for a year-long program. The program involves a meeting on the evening of our annual meeting on May 6th, monthly web-based meetings, and access to USDeN resources. These applications are due March 1st, and if you want more information, please visit the website at deprescribingresearch.org. So I'll wrap up by saying, please visit the website, which is featured here, deprescribingresearch.org, where you can find all sorts of great information. And if you would, please join the network by pressing the red button in the top right-hand corner. Thanks very much for your attention. And with that, I think we can open it up for questions and answers.
Great, thank you, Amanda. This is Ken Bookvar. I'm going to narrate the questions. They're also visible on the Q&A box. The first couple of questions. One is there a budget template you'd like applicants to use?
I think there is a template on the website, but I'll ask Mike Steinman to answer that for sure.
Sorry, just unmuting myself. Yes, there is a budget template. I'm pretty sure it's on the website, though I need to double check. It's basically a pretty standard one-page, just line item in broad strokes, who's being funded and what expenses are. So nothing surprising and fairly simple. But and we'll double check to make sure if it's there. If it's not, we will add it.
Thanks, Mike.
Good. Second question is, are stakeholder letters of support requested?
No, there's no specific requirement for a letter of support. However, I think identifying the group with which you want to work with ahead of time would be useful. And if you have relationships already established with groups, you need to delineate how they're going to be involved along the steps of your project.
Okay. Question, how would the expectations for an international applicant PI be different from a U.S. applicant PI for a pilot trial?
So the expectations are the same as far as all the materials that are needed for applying for the grant, as well as the expectations of having the quarterly check-ins and being engaged with the other people in the community. I think the main difference is that it needs to be clear about how their work is relevant outside of their home country, particularly to patients and other stakeholders in the United States.
Great. Next question is, most institutions have 60% or greater indirect rates. So is the direct cost ceiling for applicants adjusted to fit within that $60,000 cap, or is it on top of that $60,000 cap?
I am going to defer this to Mike Steinman again.
Sure. So just to give an example, so for those who aren't familiar, indirect rates are also called FNA rates. They're basically a tax that your institution charges on top of the amount of money you actually have to spend on the research itself, which is called the direct costs. Many institutions have an indirect rate in the order of 50 to 60%. So say that if your institution has an indirect rate of 50%, that means of the total of $60,000, you can ask for $40,000 of direct costs, which actually supports the research, and then your institution gets $20,000 or 50% of that total. If your indirect rate is 60%, the breakdown is, I don't know the exact math, but it's somewhere along the lines of maybe you get $37,000 and your institution gets $23,000. So even with the highest indirect rates, you're still probably talking a total direct costs, which are available for the research, at least $35,000 or more. In most institutions, it's going to range probably $35,000 to $40,000 of costs that you have. So of 60K is the total for both the indirect and direct bucket. Hope that's clear.
Just to add, this is Cynthia Boyd speaking. There is a different allowed international FNA rate which is on the website.
Correct, and that's maxed at 8%. So in a way, the lower your indirect rate, because the total of $60,000 applies across the board, the more money you have to spend on the research, and that's just an unfortunate disparity that exists between some organizations.
Great, thank you. A couple of other questions. One is, are PharmDs eligible? And yes, first, are PharmDs eligible? And I think the
Yes.
answer to that is yes. Are the slides for this webinar available? And they will be posted on our website within a couple of days. And another question is the meeting of our USDeN to be held at the same venue as the AGS meeting? It's in the same city and it's at the same conference center, so the answer is yes. Other questions? Can you elaborate a little on the Junior Researcher Intensive Program? Should the applicant have a project already underway to be eligible to participate in this program, or will the program be used to develop a project? And will that program start at the AGS meeting and then continue asynchronously? Jen, do you want to take that one?
Sorry, I was trying to unmute myself there. These are great questions. We are interested in folks who have a track record and strong interest in deprescribing at the junior researcher level, but you don't necessarily have to have a project underway to be eligible to participate. The details of eligibility are actually at the website. And yes, the program is actually following the first national meeting, which is the Wednesday before the AGS meeting.
Right, and yeah, just to reiterate, the Junior Faculty Intensive is for people who are just starting out. You do not need to have a project, and it's thought of as a year-long program that includes these webinars. The timeline is applications are currently available. The application is available on the website, due in early March, and so we will, and then selected in March with a first webinar meeting in April, and then meeting in person at AGS or at the pre-conference at our USDeN pre-conference meeting. So next question is, will relevant...
Can I just add one thing real quick?
Yeah, go ahead.
So thanks. I mean, it's a great explanation. Just to kind of add two other points is, you know, that the real goal of the Junior Investigator Intensive is to give people exposure to networking and opportunities to advance research. And there's sort of two types of research we think will be successful to advance through here. One is it'll provide you resources and feedback and ideas to advance any of your own research in deprescribing or related topics that you're pursuing. We're also hoping that through the cohort of junior investigators that we develop, there'll be some collaborative research projects that will emerge from this cohort that you can be involved in, either in a leadership or a supportive capacity.
And applying for the intensive is not mutually exclusive from one of the pilot applications, so you can do both, and encourage you to do one or other or both.
Correct. And the intensive application is fairly brief, so hopefully the barrier to entry is low. One other thing that's just want to make sure we highlight is that people who apply for the intensive can also apply for travel scholarship funds, which will pay for airfare and hotel to attend the annual meeting. And so that's linked up with the application process, and it's all there on our website.
Great. Next question is, will any relevant U.S. deprescribing research be considered for grant support, or is it limited to pilot deprescribing trials?
I'm going to ask Dr. Sandra Simmons to answer that question.
Hi, this is Sandra. I think that takes us back to the scope, which we tried to describe earlier. I'm not sure, the question is a little bit vague. It certainly doesn't have to be a pilot randomized controlled trial, if that's what the person's alluding to. It can be a descriptive study. I think we mentioned that various methodological approaches could be used. It could be an in-depth qualitative analysis. So it doesn't have to be an intervention trial, if I'm understanding the question correctly.
Okay. And there's another question from somebody who's farther out from their training, but interested in, and it doesn't have a independent investigator award yet, and is wondering if they are eligible for this pilot and grant planning award.
That's a great question. So we don't have a number of years out from training specifically. We do want to focus in, particularly for the pilot awards, to junior researchers who have yet to get typically like our level funding. But the grant planning activities award can go to somebody who is a little bit further beyond like their K award or a career development award.
And this is Cynthia Boyd. I would just ask if we definitely would like people who have specific questions to feel about whether or not they're eligible to feel free to reach out to us. We realize there's a lot of, unique circumstances people have, and we'll do our best to, get you a timely answer. And I think, when there's, for example, part of the reason for not a strict number of years is there are people who may have spent, time away for military service, family obligations. So we would encourage people who think they might be eligible to reach out to us, and don't be discouraged from inquiring, because we are hoping to open this up and get a large group of people interested in furthering or embarking on deprescribing research.
Okay, well, that's all the questions we have right now.
In case anybody was wondering, I was just going to add that the annual meeting for our network will not be at the same day and associated with the same professional society meeting every year. So we hope to move it around so that there's, we encourage people from different societies to join, mostly around generalists and geriatricians, but we hope that that brings a diverse group of people to the meeting, and so that it's not at the same, it's not associated with the same national meeting every year.
Question?
Yeah, and we're definitely very interested in people from all disciplines: nursing, medicine, PharmD, others. We really aim to have a tent, and we would encourage people also who are perhaps trained in a specialty to consider deprescribing and applying for these deprescribing awards or the intensive as well. We feel like deprescribing is one of those things that really is very interdisciplinary in nature, and in order to really understand what works and what doesn't, that we are going to need a really broad group of people working on the issue.
Just to add, which you may or may not have said, is that you can register and attend the annual meeting without applying for either of these mechanisms. So that registration link is available on the network website as well as the AGS annual meeting registration website. There is another question that came in, which is, do we envision larger grant programs in the future?
So not particularly through our network, although we're hoping that what we find out from the pilot programs and the grant planning awards is that those will lead to larger studies. I don't know if Mike or Cynthia want to add to that.
Yeah, I think that's well stated. I mean, our network's not in a position to itself fund a very large study. We don't have the budget to be able to do that. But what we really hope to do is incubate people who are interested in doing large studies by providing the resources, providing the grant planning awards that provides the money to kind of plan, for example, a large multi-center trial, hooking people up with the appropriate FOAs from NIH, and kind of helping to develop the collaborations and research teams. So we're hoping to provide a lot of the ancillary support for these large trials, even though we're probably not going to be the one doling out, you know, $1 million of money ourselves directly to your pocket.
Those are the questions now. We do have a suggestion to the panelists to consider planning a meeting prior to the American Society of Consultant Pharmacists annual meeting, which I think is a good idea. Okay, so there is another question. Would the network consider letters of support or endorsement contributing letters of support for investigator-initiated NIH applications focused on deprescribing? So I think what that question is Mike and Cynthia, would we be able to provide endorsement of other people's applications in other mechanisms?
We're still developing our policies for exactly how that will go down, but I anticipate what will likely emerge is that we will be able to provide letters of support that articulate, you know, how the proposed research fits in with the network and what resources the network can provide that will help that research to succeed. We're probably not going to be positioned to say, like, this specific project is the best thing in the world and you should fund it, because we're not kind of like the judge of individual projects. But we very much want to communicate to NIH that we're happy to work with you as an investigator. We're happy to leverage the resources of the network to help make your project succeed. So we'll formalize exactly what that looks, but that's probably the outlines of what we'll be able to provide. And I just want to reiterate something that was said earlier. If other questions come up along this line or anything else, please don't hesitate to reach out to us. Just shoot us an email. We'll be more than delighted to talk with you individually about your individual question or issue.
Okay, I think that's all we have right now.
So there is a little bit more time left, but barring further questions, I would like to thank Drs. Mixon and Simmons for taking the lead on hosting the webinar and for sharing all the information and doing all the hard work to pull the pilots together. And I want to thank all of the participants and all of the very important and insightful questions that we had today. The recording of the webinar will be posted at the US Deprescribing Research Network website. And thank everybody for being here. I want to wish you all a great rest of the day.
Jen, I do have a question coming in.
Okay, what's that?
It's with page limits. So can you please confirm, is the page limit for the mentoring plan and the mentor letter one page for both or separate? I also, Amanda, if you could also just be clear about what's included in the 5 pages of the research narrative as well.
Sure. So the way that we have it phrased is that the one-page mentoring plan plus a letter of support from the primary mentor. And then in the 5 pages, that is to include the study aims, the significance, the innovation, the approach, future studies or directions, and the stakeholder engagement.
So,
As well as the
one page for the letter and then a separate page for the mentoring plan?
Yeah, I think that makes sense.
Okay, and a title page, right, was
Yes.
part of the...
Yes, and the title page is included in the 5-page limit, and that has all sort of the demographic information about the applicant.
And just to reiterate, the purpose of the mentor letter and the mentoring plan is we realize that being a early stage investigator, there's still a lot of learning going on, and we just want to make sure that you have access to appropriate mentorship and involved mentorship in a way that's going to actually kind of help you succeed not only in this project but then kind of in taking it to the next step. So just sort of keep that general guidance in mind. That's why those elements are there. So feel free to take advantage and articulate that as you will in that mentor letter and the mentor plan.
Thank you. Thank you, Mike. Any other questions? We'll just leave for another minute and see if any other last-minute questions come in. Other last words of advice?
Jenna, maybe come back to one earlier question. Someone had asked about international or non-U.S. based applicants. We addressed the financial issue. Do you want to talk, or Amanda and Sandra, talk at all about, is there anything different about people applying from outside the U.S. in terms of what's expected?
No, the components of the application are the same, and we, once they are awarded, we also want them to be participating in the calls, the webinars, and obviously attend the annual meeting as well. So hopefully there's very little as far as differences between the domestic and international participants.
Yeah, and if the calls end up being at 2 o'clock in the morning, given your time zone,
Right.
there are ways around that. So don't feel like compelled.
Right.
And I think just to reiterate, I think something that was said earlier for international people, it will be important to make a case how the work you're doing is relevant in other countries, including the U.S. So work that's very specific to a health system or way something works and that is completely different in other countries would be, thinking about those issues and how it might be generalizable or translatable to other countries, including the U.S., would be important to convey, but within the page limit of the science.
That's very helpful. Thank you. So take two on wrapping it up. I want to thank everybody again today, and please don't hesitate to shoot us your questions, and we encourage you to apply, and we look forward to seeing a lot of really great applications. Thank you, everyone.